Hello, Blazers. Welcome to episode 141 of UAB Green and Told, originally released Monday, January 13th, 2025. Through our podcast, we are given the opportunity to share stories from members of the UAB community. Green and Told is the most listened to podcast on campus. Want to check it out? Visit alumni.uab.edu/greenandtold or on Spotify or the Apple Podcast app. And while there, leave a written review so more alums can find us. I'm Greg Berry, a UAB alum and Director of Communications in the Office of Alumni Affairs. Today, we welcome Dr. Tony Jones. We will discover his fascinating journey as a medical professional whose passion for science led him down the path he took.
Oh, wait a minute. There's a specialty that is built and predicated entirely on those three disciplines? Are you kidding?
Plus, we'll also pinpoint parallels between two prestigious institutions he worked for, Mayo Clinic and UAB, both of which share a pursuit of remarkably high standards.
At the front end, there's this unmitigated commitment to excellence, period. Okay? And that translates into all sorts of different things.
And Dr. Jones will share a pivotal conversation with his wife that ultimately led him back to Alabama, one that you can say is just what the doctor ordered.
Evelyn, we have a problem. We have a serious problem. I said, I believe that I can accomplish the things that I wanted to accomplish as a chair much more readily here than I ever could have accomplished at the Mayo Clinic.
An Army brat born in Anniston, Dr. Tony Jones has always had a passion for the sciences. His interest in anesthesiology was sparked when he discovered a specialty that perfectly combined those disciplines. Dr. Jones's dream of donning a doctor's coat never dimmed. Even as he navigated challenges life threw at him, his dedication to medicine remained unwavering. And you may be surprised to learn that his lifelong passion to become a doctor was inspired by, of all things, a TV show.
As far back as I recall thinking about, well, what will I do when I grow up? I've always wanted to be a doctor. And the interesting thing is that I actually attribute that to a television show that I just adored when I was growing up. So obviously, when I tell you this, you know I'm a nerd, but it was a show called Marcus Welby, MD. And, you look a little bit younger, but certainly my fellow alums will recognize that show. It was a show of a family medicine physician who starring Robert Young, right, as Dr. Welby. And he was a general practitioner. And, it was the classic 50s and 60s portrait of what a physician did by taking care of generations of families and going to their homes to take care of them. We ask ourselves, as kids growing up, they get exposed to something and it just connects with them. Of course, the science and the medicine was part of it, but a big part of it is the recognition of how he led in the community and the relationships that he established with people. And, I look back and that's how I am today. I'm highly sensitive to relationships. I think those are critically important in both our personal and professional lives. And so that it really connected with me. I've always thought I wanted to be a physician, and it was guttural. It was instinctual. It wasn't a calculation by any stretch of the imagination.
Not only did you kind of crisscross the globe when you were younger, mainly Europe, but when you came back even to the United States, Virginia, Anniston, over to Tuscaloosa, back to Birmingham, why did you ultimately choose UAB for med school?
Yeah, I wish I had a real comprehensive answer to that, but the reality is it was down the street.
Sure.
Let me tell you, it had such a great reputation. I actually did look broadly at various schools and opportunities, but the value proposition, when you looked at the reputation of the school, but also the fact that it's a state-funded school, and the reality is that financially, it was when you look at that value equation of the quality of education, its reputation, the scope of what you can learn there relative to the cost, it was objectively the most rational decision. And so that was the largest part. I had no incentive to leave the state. Why would I do that? My family's here, and my friends are here. I really enjoyed the community. And so why leave? So that combination of things, while I did kind of look around a little bit, once I found out I was accepted to UAB, I mean, I had nothing else there was no reason to consider anything else.
The main part of UAB Hospital is basically still the same from when you were a student back in the
Mhm.
80s. Talk a little bit about, how today it's a world-class institution. What was it back then? It was
Mhm.
laying the foundation. It had a great reputation, but it's not the place is today.
Yeah, so that gets into a lot of things to talk through. The reality of things is that I can only answer that after having a career, right? Because as a medical student, you're pretty myopic in terms of how you're perceiving your environment. You are spending 8, 10 hours a day in class and in studying, and that experience was largely inspirational, quite frankly. I made a lot of lifelong colleagues, but I did have some disheartening experiences, which actually in some ways led me to leave Birmingham. And those were really a time when there were very few African Americans that were in medical school, and the sort of environment was not all that supportive. Nowhere near as so today, because there's so much more, I think, awareness
Sure.
and progress have been made just across the country in terms of the acceptance of diversity and differences, right? But back then, I was experiencing some things that only now today, looking back, that I truly understand what they were. And today, we call them microaggressions.
Okay.
And these are just simply, not really outright aggressive or objectively racist attitudes and interactions, but ones of just these ongoing slights, right? That you can't quite tell, well, did they really mean it this way or did they mean it that way? But what it did is it left me with an uneasy feeling
Sure.
about what might be my opportunities here. When I decided to leave, I didn't even consider UAB as a resident, even though overwhelming. I want to restate this. Overwhelming, my experience was very positive. Otherwise, I wouldn't be here today, right?
Yeah.
And a strong supporter of UAB, but it was enough of a push combined with what I call pools, which are that opportunities that presented themselves. While all of that experience is true, while I was a third and fourth year medical student down in Tuscaloosa, there was a surgeon there by the name of Bill Shamlin. Bill Shamlin was a surgeon who also trained at the Mayo Clinic, whose family members also trained there for generations. And all of them came back and practiced surgery within Tuscaloosa or the surrounding area. And in fact, that's my connection to the Mayo Clinic, because I thoroughly enjoyed, but he made it his goal is just based on the way that we work together as a student and as a faculty, that he really felt like I had to go there for my residency. And so he actually made phone calls and facilitated the opportunity for me to go up during my fourth year to spend a month with a surgeon up there by the name of David Nagorny. And David Nagorny is a world-class liver surgeon. But while I experienced these things that sort of pushed me away, there were also these experiences that made it the right thing for me to go and leave and go to the Mayo Clinic to do my training. And while I went up there for that for that 1 month experience, it was during that experience as well that I started asking questions about who are those people on the other side over there. And it turns out those were anesthesiologists, and a specialty that I had never heard of until I was in medical school, but it was instantaneously stimulating, intriguing. I love basic science and physiology and biochemistry and so forth, and pharmacology. And oh, wait a minute, there's a specialty that is built and predicated entirely on those three disciplines. Are you kidding? And so while I was at the Mayo Clinic doing that rotation, Dave Nagorny called me into his office and said, "You did a great job, and I'm willing to write a letter of recommendation for you to become a resident in surgery at the Mayo Clinic." And I informed him that, I decided actually I want to do anesthesiology instead. And he was amazing. He said, "Okay, I'll write a letter of recommendation for you for that too."
That's awesome.
And that's how I ended up going to the Mayo Clinic. And, a lot of life's experiences, we all grow up and have, I think, experiences that are both negative and positive.
Mm-hmm.
If we're fortunate in life, then the overwhelming majority of our experiences are going to be positive. I think the important part for me and the learnings over the course of the years, when I look back in those 4 years of experience, is how does one balance those two things? And what I can tell you is even those activities, those experiences that I would just say were a bit disheartening, they're part of who I am today. They're part of who made me who I am today. So I embrace those things, not in a negative way, but in ways in which we can understand those things and work towards all of us becoming better human beings. And that's, I share those stories with folks not to say anything negative. It's real, but it did help shape who I am today and how the leader I became as well.
I love the parallel that there is drawn between UAB and Mayo Clinic. There's a lot of similarities. Yes, there's differences, but both are in the heart of a downtown. Both are globally renowned for what they do. Touch on some of the parallels you saw over the years, and a lot of it might be when you became an administrator here at UAB that you reflecting back at Mayo, but There's a lot of similarities.
Oh yeah, there's no doubt about it. And there's so many people that I knew. I mean, when I went up there for that 1 month, the number of people I met up there as residents and physicians on faculty from Birmingham. Come on, it's just strange, but it became obvious to me, even though I didn't understand it. There is a relationship. There's a connection. There's a sort of a kindred spirit, right, between both organizations. And I will actually attribute it to, and the story of UAB and how John Kirkland left the Mayo Clinic and came down here. And there's no doubt that when someone of that stature, he brought with him, right, and on over a large amount of time, inculcated within UAB the same sort of culture, if you will, professional culture between the two organizations. And at the end of the day, that is it, right? Culturally, there's a lot of similarities. And what do I mean by that? At the front end, there's this unmitigated commitment to excellence, period. Okay. And that translates into all sorts of different things in terms of the quality of care you give, the type of training, your commitment to teaching, but your commitment to leadership and to taking balanced risk and advancing your specialty or your practice or your space. At its core, I tell people that when I left Mayo Clinic to come to Birmingham to be the department chair, I describe it as I felt like I was just slipping into a warm bath. Right. There was just so many things that were very similar. There's some differences too.
Sure.
But so many things. And it actually centers around what is the culture of excellence that is very similar between the two organizations.
You spent a decade and a half in Rochester, Minnesota. How did the scope of what you were doing change over those 15 years before you returned to Birmingham?
Yeah, that's a great story. It's the thing I enjoy telling people the most. I gave a talk for the School of Medicine Grand Rounds just before my retirement. And the title of my talk was Stay Curious, because you don't know what you don't know. The teachings there, if you will, in terms of my own life experience, is that when I went to Rochester, Minnesota, Mayo Clinic, I unequivocally, without a doubt, committed to my wife's mother that at the most we'll be up there for maybe 5 years, and then we'll be back home and I will do private practice as an anesthesiologist. That was my worldview at the time that I went there. But I did stay curious. because I didn't know what I didn't know. And the key thing there is because of my curiosity, I got exposed. People created opportunities for me that I had never contemplated. And the first of those was a guy by the name of Bob Lennon. And Bob Lennon was an anesthesiologist who did regional anesthesia, but he did quality research. He was already back then doing systems-based research to understand where we make errors in how we deliver care. And I got involved with the project with him because I noticed, I was curious, and noticed when I was doing my neuro anesthesia rotation that we were having some complications of what's called residual neuromuscular blockade. And all that is that when you are undergoing neurosurgical procedures, we actually use some medications that paralyze the muscles. Because you can imagine when someone's under a microscope and they're doing a lot of intricate work, you don't want the patient to accidentally cough or move and things of that nature. And you have to reverse that paralysis. And we noticed that with the introduction of some new medications that do paralysis, that we were having less consistency in how adequately we reverse that paralysis. I wanted to know why. And so he found out, hey, I hear you asking some questions about this. Let's do a system-based project around it. And so I did that research with him. And it was something that we published in a small journal, Minnesota Medicine, and didn't know earth-shattering science there, right? But what it did for me is it opened my eyes to, wait a minute, there are ways in which one can achieve excellence in their care of patients in ways in addition to your one-on-one vigilance, right? By taking a look at systems. And by the way, this is that other relationship, the systems-based approach to delivery of care, which is a fundamental principle of quality, right? That's the cultural alignment between the two organizations. Based on that, I had other questions, and so they facilitated an opportunity for me to go and get exposed to a research lab. Let me tell you, I was trying to understand, why is it? I was asking questions. Why? When you put an endotracheal tube into one's trachea, why doesn't it cause them to cough and sputter and reject it? Because if you just aspirate water, right, in your lungs, you're going to react to that. Now, there's a lot of reasons, but one of the reasons is because there's this theory that the gaseous anesthetics we use, that they cause the muscles of the bronchial, the lined bronchial, to cause them to relax. But there was no evidence of that. That was just dogma. And so I was challenging that. And Bob said, well, I know this guy up in the research lab who studies that stuff. I'm going to introduce you to him. And I went to the lab. I knew right then and there I needed to go do this, spend some time understanding how to do research like this, because I can answer some questions that I have. And so that led me to doing some additional research training and going on the NIH training grant. And oh, by the way, I'm not coming back to Alabama to do private practice at that point, because they're wanting me to stay on faculty and do some more research training and on and on and on. And next thing you know, 5 years wound up being 20 in aggregate, including my training up there from 86 to 2006. I talked where I was the accidental scientist, and then I became the accidental department chair, and then the accidental chief physician executive, right? Because I never really was seeking those things. I was just sort of pulled along the journey because of my curiosity by others.
So how did that journey get you back here as department chair?
Yeah, it's a very similar thing. So here I'm going along. I got 2 R01 grants. I've got a laboratory where I've got 20 or so odd people and postdocs and so forth. And I'm the principal investigator on a research training grant as well, where we train postdocs and everything. I've got everything going. My wife just got her dream job there at the Mayo Clinic. And so I wasn't interested in leaving. Yeah, I'm sure I was going to retire there. But one day, the chair of the Department of Anesthesia called me in his office and let me know that he's about to step down because there, it's typically between 8 and 10 years, they rotate chairs. And it was getting towards the end of his tenure, and he's going to go off and do some other things. And he asked me, was I interested in becoming a department chair? And my answer was, no, not over my dead body. Why would I do that? I'm having a blast as a scientist and a clinician. So the way that the Mayo Clinic recruits their chairs is almost always within, and they interview every single person on faculty. And so I went into my interview with the goal of sharing with the personnel committee, here are my 3 recommendations, and here are their strengths and weaknesses, and how I would rank them. And so I gave that presentation to the committee, and then at the end, they said that was fantastic. And then the chair of the committee, Claire Bender, asked me, well, what about you? And I said, what about me? She said, you were 1 or 2 or 3 on everyone's list. And my question was, why? Why was I on their list, right? Because it was just not ever in my worldview of thinking in terms of myself. But here's the thing. I walked out of there and I told my wife, she said, no, you'd be a great department chair. And then so with that, I began thinking to myself, well, if I were a department chair, well, what would I do? What would be my goals, objectives? What would be the reason to leave what I'm doing now? And the problem with that is once you start asking and answering that question, the genie's out of the bottle.
Yeah.
It's hard to tuck that back in. And so at the end of the day, I became a candidate, and I landed in the top 3. The person who was my top candidate turned out to be chosen as chair. So I was very supportive and happy about that, and in some ways relieved. And I said, okay, man, I can get back to science and research and not worry about these other things. But a couple of weeks later, I got a call from UAB to see if I would come down and just take a look at the department chair job here. It had been open. They'd been interviewing for a while. You're an alum. We'd love to have you come take a look at it. The reality is I originally said no, thank you. But I was talking to my dad one evening. He says, man, you never turned down a job you hadn't been offered. That's stupid. So I called him back and said, yeah, I'll come look. But I was really just coming down. In fact, I didn't tell my parents. We didn't tell anybody, right? Because my thinking, I was come down here, give a lecture, have some discussions, and thank you very much, and go back to my work at the Mayo Clinic. But 2 days into the interview process, that evening, I called my wife up and I said, Evelyn, we have a problem. We have a serious problem. I said, I believe that I can accomplish the things that I wanted to accomplish as a chair much more readily here than I ever could have accomplished at the Mayo Clinic. And it had to do with the way the organizations were structured, right? At UAB, a department chair is executive leadership. You are your chief executive of your department. You are responsible for everything, and your vision can be enacted as your vision as a department chair. Mayo Clinic, great organization, but it is a centrally regulated and managed institution where department chairs, their jobs were to execute on institutional decisions, right? At the end of the day, I said, you know what? My wife agreed. She came down and visited. She too saw Birmingham and UAB and said, yeah, we got to come do that. So we packed our bags up. And despite my kids going into some very critical parts of their own development, we made the move here. But again, it's the same story. Stay curious. You don't know what you don't know.
Thinking back to when you were a first or second year medical student in Birmingham, could that person have ever thought you'd accomplish what you did returning to UAB?
No, not even close. No. And I think part of the reason, and I think this will resonate with most people, is you know what you believe you can do is predicated on what you've been accomplishing. You know, it's like when I said, goodness gracious, these people at the Mayo Clinic accepted me in their residency program. Am I really up to that? You find out one day, yeah, I actually am. And then the next thing you see, well, am I up to that next step? And then you do it, and it builds confidence and expands your mind. It expands what you think you can accomplish. It actually helps expands the reasons you want to do things, right? No, there's no way, because I hadn't had the experiences yet. I mentioned before about how good and bad experiences shape who you are. There's no way for me to know who I was going to be without going through that journey.
That's Dr. Tony Jones. Recently retired from his role as Chief Physician Executive at UAB, Dr. Jones earned his MD from the Heersink School of Medicine in 1986. As a lifelong member of the UAB community, Dr. Jones has a great understanding of what it means to be a Blazer.
My experience as a Blazer, of course, was a medical student, and then ultimately coming back as a much more mature individual. And what it means is just unmitigated pursuit of excellence. And we see it even in, what's so fascinating to me, we see it even not just in medicine, but across the university. We punch way above our weight. And at the end of the day, it's because we recruit people that have recognized that there's an opportunity at UAB to really pursue your interest and passion, and you really commit to it. That commitment, that culture of excellence, and have unmitigated commitment to it, right? I saw it as well when I was a department chair and working with other schools. One of the things I found fascinating, by the way, this is one of the things I'll say is fundamentally different from UAB than almost any other academic medical center I've ever seen. And I've been to many. And it's this collaborative experiment, this collaborative esprit de corps among the schools. We got the harebrained idea one day of wow, the NIH, they designate institutions in terms of their excellence, centers of excellence in pain, education, and research. We had a lot of people at UAB that were doing pain-related education, from clinical psychology to anesthesiology to nursing, right? All these different schools had some element, right, where they were kind of doing things. But to become recognized as a center of excellence, and at that time there were only 5 in the country, I said, just here, Brian, let's go talk to the dean of the School of Arts and Sciences for psychology. Let's go talk to the dean of nursing, and we just talked about, well, would this be fun to do, right? And back to that, having fun with people, and so we came together, put together a little task force, and over a couple of years put in all the elements that are important for to be recognized as a center of excellence. And oh, by the way, in the process of doing the things to be recognized, we were doing a lot better job in pain, right, for patients and for students. And then so back in 2011, 2012, we were recognized as one of the very few centers of excellence in pain medicine. But it's that collaborative spirit, particularly in research and particularly in education across all the schools. I was able to do that, all those sort of things all over the place, not just within the School of Medicine, but across schools as well.
Be sure to check out past episodes of the UAB Green and Told podcast. Listen in at alumni.uab.edu/Green and Told. Have a story to share or know someone who does? Email greenandtold@uab.edu. Finally, be sure to follow us on social media. Just search UAB Alumni on Facebook, Instagram, and Twitter. Thanks for listening, and until next time, go Blazers.